isn't any short way of making sure that you get a trilaminar endometrium. There is no magic bullet for it, but however, there are certain things or adjuvants that you can use to try and get a trilaminar morphology of your endometrium. Some of the adjuvants that are there in literature is low dose aspirin or ecosprin. There is use of arginine sachet. GCSF can be either used as an intrauterine instillation or subcutaneously, depending upon the dose that your fertility physician is comfortable using. Also, sildenafil is used sometimes to kind and achieve a trilaminar pattern. Of course, there are many more adjuvants available out there, but you will have to discuss it with your fertility physician as to what they have achieved success, what are they comfortable using.